Hello and welcome. Today's episode is on how hemifacial spasms can affect the quality of life of the patient. Hemifacial spasm can be a fairly debilitating condition and can significantly compromise the quality of life of the affected person. The shame, the social isolation, the loneliness caused by embarrassment of the hemifacial spasm are some of the reasons why the psychology of the sufferer is very severely affected. Hemifacial spasms are characterized by involuntary movement of eye and half of the face on the affected side. The cheek muscles or the eye muscles go into involuntary spasms and they increase in frequency and intensity in stressful conditions during public speaking or while speaking to strangers. By themselves, these spasms are not life-threatening, but in very severe cases, when there is sudden eye closure, driving and operating heavy machinery may become dangerous. Spasms typically begin around the eye and as the disease progresses, affect the cheek muscles on the same side of the face. Sometimes the lip and neck muscles are also pulled to one side, leading to great distortion of the face. This leads to a grimacing look. Hemifacial spasms may pose difficulty in professions of the affected people, especially if they involve social contact or the profession itself has a potential to be hazardous. It can also cause difficulties in driving vehicles and be dangerous to self and others. It may prevent people from pursuing their hobbies or activities and bring down their morale. Hemifacial spasms also affect reading quite significantly, as well as while using devices like mobile, computers and watching TV. Hemifacial spasms can also have a deeply negative psychological impact because the patient tries to avoid eye contact with others and prefers not to be photographed. They may also suffer from clinical or subclinical depression. Some prefer to be in isolation from family and friends, and some others actually live in fear of social interaction and may actually have had experiences of facing social embarrassment. This feeling of embarrassment comes from the spasm, which causes a winking-like effect of the face and eye in quick succession. This makes the person worried and anxious about how their friends or relatives, or more importantly strangers, would react to their spasms. Severe hemifacial spasm may also lead to sleep disturbances, leading to chronic sleep deprivation and irritability. At our MVD center in Pune, we have performed MVDs for hemifacial spasm on more than 350 patients so far in the last 15 years, and what we have seen is that most patients face the problem of getting the right advice at the right time. They typically describe paying multiple visits to the ophthalmologist, the neurologist, or even the cosmetician looking for a treatment in vain. So, many months and years of suffering from hemifacial spasm lead to disturbed sleep, problems at workplace, stress, social isolation, anxiety, and all these have the potential to send the patient into a negative spiral of depression and social withdrawal and even occasionally suicidal thoughts. Typically, patients start looking for permanent solutions and surgery when they are at the end of their tether and when they feel they will snap if they don't get treated. So what is the treatment? Though medicines like anxiolytics and muscle relaxants may be prescribed, they are in general not useful. Botox causes facial muscle paralysis at the site of injection and needs to be given repeatedly because its effect is temporary. The actual cause of spasm is left untreated and the disease worsens over a period of time. Microvascular decompression for MVD surgery is at present the only option for offering a potential to cure patients from their hemifacial spasms. This also offers them a shot at a better quality of life. At our MVD center in Pune, We offer MVD surgery for hemifacial spasm fairly early on in the disease, as surgery alone has a possibility to permanently cure the patient from their suffering. Thank you for watching, and do subscribe to our channel for more.